This video will focus on briefly highlighting the key points for the Chapter 6, the chapter in your pharmacology textbook that focuses on the place of patient education when it comes to giving meds to our patients, and also how to put together a more formalized teaching plan for an individual patient about the medications he or she is taking. So the first slide here basically tries to make the case that in fact patient education about their medications is important, and I think that almost goes without saying, but it's important to say it. It does. It's very important. This slide talks about, it's a bit of learning theory, if you will, and talks about the different domains of learning that exist for us. There's the cognitive domain where we learn just knowledge, new knowledge, and we typically incorporate that new knowledge into what we already know, the existing knowledge inside our heads, if you want to call it that. The affective domain, which is what we call the domain of our feelings, our emotions, but also the things we value. And we can tell that a patient values taking their medications by the behaviors that they exhibit. They use the medication planner. They get their prescriptions refilled on time. The blood levels of their medication are within the therapeutic range. When they're following behaviors that indicate they understand the importance of and value the importance of adhering to their medication regimen, they exhibit behaviors that indicate that are consistent with that valuing and that understanding. And then lastly, the psychomotor domain, which we often call the doing. You have a skill that you need to do with your hands. And so we as nurses put together a teaching plan for teaching patients how to learn this new skill. A lot of times it involves using a medication, using some sort of an electronic device, or drawing up insulin into a syringe, or there are just lots of skills that go around medication administration as well. I went over this in class, comparing the steps of the formal teaching process to the steps of the nursing process. And so when we know that we have a patient who needs to be taught something specific, whether in the cognitive, affective, or psychomotor domain, we go through the same assessment, diagnosis, planning, implementation, and evaluation processes in the course of doing the education. And so I went over in class, and this is described in your textbook, all the things you want to assess in your patient before you actually put together a teaching plan. We talked about cultural background. Are there barriers to learning? Is the patient visually impaired, or deaf, or hearing impaired? Those are things. Literacy level. What is the patient's reading level? Can the patient read? Because some of our patients are functionally illiterate. They cannot read, or cannot read well enough to learn things from printed materials. How do they like to learn? Do they prefer to watch a video? Do they prefer to read printed material? Do they prefer to have somebody demonstrate, or do they like to read the step-by-step instructions and do it on their own? People have different ways of learning. The notion of health literacy is very important in this day and age, and we talk about not only reading literacy, can people read, but what is their understanding of health concepts, health terms? Can they read a bit of printed instruction and understand what it means for their health status? So box 6.2 in your textbook is really a very, very important box that gives you a background or overview of what the concept of health literacy is, and how do we assess it in our patients. Because if your health literacy is low, you probably are not going to understand what your doctor or your nurse is telling you. If you don't understand the instructions, you won't be able to follow the instructions. You won't be able to read your insurance forms, because they a lot of times talk about health status. You won't be able to fill out your health history form in the clinic. There's just a lot of issues with low health literacy and quality of care. We talked about quite a few of these things, like health beliefs, in class as well. And what's their current medications, whether that's the general medication profile or filling out a med reconciliation form from facility to facility, and so on. Lastly, are they ready to learn? Among other things to assess. Are there um, are they nowhere near ready to learn? They have just received a new diagnosis of some sort of earth threatening, life threatening diagnosis, shattering, and they are emotionally in no place to sit down and have a nurse teach them about their new medications. The timing of our instruction needs to be sensitive to what the patient's needs are based on our assessment of them. There are a number of nursing diagnoses, and these are listed in your textbook, that are appropriate for some patients as they relate to their education about their drugs. And so these are important. If impaired memory is an issue, would there be memory aids? Could we, draw a clock on a piece of paper and write and put a star by 8 a.m. and a star by 6 p.m. or something like that? How about the little med planners, the plastic boxes with the Sunday, Monday, Tuesday, Wednesday, Thursday boxes? And sometimes these med planners have up to 28 boxes where there's Sunday, Monday, Tuesday, but there's breakfast or morning, lunch, dinner, and evening, bedtime boxes. So those are memory aids that can help people remember when to take their medication. They know what day of the week it is and they know that it's supper time, and they open the box for supper time and take the medications. Lots of different diagnoses that may apply. Then there's the planning phase, and the notion, the distinction between goal and outcomes, and overall goal. And I tried to give you examples here on this slide. If the overall goal is that the patient is going to learn how to monitor and be able to monitor their own capillary blood glucose values daily, then what are the specific outcomes? They're going to know that what are the needed supplies that they're going to collect. They're going to be able to demonstrate the use of a lancet. They're going to be able to take that drop of blood and apply it to a test strip. They're going to be able to insert the test strip into the meter and activate it and accurately read the results. And I could have put a step on there, record the results, because most people who are doing their blood glucose self-monitoring have a diary of their blood glucose values, and they're going to write it into. So when we're writing these goals and outcomes, they are in patient terms. They're patient will. What does the patient need to do? They need to be measurable or observable. They need to be realistic. Somebody who's blind is not going to be able to tell time using a clock with numbers. They're going to have an audio clock or something like that. And typically we'll put the time frame in. Now, the time frame is not listed in here. Maybe you have just one teaching session. And so at the end of that one teaching session, you want the patient to be able to do this, this, and this. And if there are other learning outcomes that need to be achieved, then another teaching session will need to be scheduled. We use a range of teaching strategies in some hospitals. There are literally televisions in every room. You've seen that probably. And there may be an inside the hospital network, so to speak, where there is a menu of videos that patients can watch. They're patient education videos, and they're on a huge array of subjects. And so the patient can watch those education videos that apply to whatever condition they're in for. Nurses do a lot of verbal instruction. We hand out written material. I've mentioned the videos, and nurses often demonstrate. If a patient needs to learn how to give themselves an injection, or how to draw up medications into a syringe, or how to use an inhaler, the nurse is going to demonstrate first to show how this is done. When we implement the teaching plan that we have put together, we schedule those learning sessions, and we make sure that the materials that we need to do the teaching are on hand. We need to be aware, are we teaching a 5-year-old? And you'd be amazed what a 5-year-old can do. 5-year-olds can do quite a bit. If they have a chronic disease like asthma, and a 5-year-old needs to carry their rescue inhaler with them all the time, then that 5-year-old needs to know how to use that rescue inhaler. And they're only 5, but you'd be surprised what a 5-year-old can learn how to do. And so but we are going to be sensitive to their age when we do the instruction. Language barriers. Do we need an interpreter? on hand. Who should be included? Is it the patient? If it's a child, the parents. If it's an older adult who has a caregiver, the caregiver, and so on. If it's somebody with a memory impairment, who helps them remember their health care? Those are important things to remember when we're actually sitting down to implement the instruction with our patients. So we carry it out with respect to all these factors and any others you can think about, and then we need to evaluate or validate whether the patient has actually learned. And in this case, there are a lot of strategies to validate patient learning. You can ask the patient questions. You can say, okay, can you describe for me this step? Tell me about it. It's actually called a teach back, or it can be a teach back where you literally say, okay, now I've taught you, now you teach me. Go through the same steps and show me, pretend I don't know how to do this, and you're the instructor, and you're teaching me how to do this. How are you going to do it? If it's a psychomotor skill, have the patient demonstrate. You've demonstrated to them, now they're doing a return demonstration. You could call their return demonstration the teach back on a psychomotor skill. Maybe you're going to observe the patient's behavior over time. If you're the home health nurse and you're stepping into the patient's home every week, you're looking at their patient's weekly med planner. Are the boxes empty? Are there boxes that aren't empty? Which means those are missed doses of their medication. Are they adhering to their medication administration schedule? And of course, we're always watching for therapeutic response and the occurrence of complications or adverse drug effects. Those are ways to monitor the effectiveness of your patient teaching and actually validate whether the patient actually learned something. If we find that the patient doesn't know what we were hoping to teach them, or that there are complications that are occurring, or they're not adherent, then you pull out that original teaching plan and you revise it. There's new information you need to add, or develop a new one as needed. And then, of course, we're going to document. And most electronic health records have built-in patient education fields where all of these things are included. What was your basic assessment data? What were the outcomes? What did you actually teach or demonstrate? What instructional strategies were used? What was the patient response? And the evaluation. Did the patient learn did they meet their learning outcomes?